Hello, kidney warriors. James here from Dadvice TV, your online kidney health coach, and this is another episode of Dadvice TV Live. And for all of you out there who are watching us for the very first time, welcome. It is great to have you here. Go ahead, say hello in the comments, introduce yourself. We have a great community here at Dadvice TV that's very positive, supportive, and helpful. And for those that are new, let me introduce myself. My name's James. I have kidney disease. Matter of fact, I was diagnosed with stage 5 kidney failure when I spent a week in the ICU almost 2.5 years ago. Now, since then, I have not gone on dialysis. I have not gotten a transplant, but I have learned so much about diet and lifestyle and getting my blood pressure under control, keeping my blood sugar looking good, and I've gotten healthier overall, which has helped my kidney labs to improve and me get rid of all my symptoms. I am not letting kidney disease hold me back. Now tonight, we're going to talk about a very common question that I see a lot from those that are, at the lower end of kidney disease, stage 5, or even some people on dialysis, itching with kidney disease. And when I was diagnosed, I suffered from that itching, especially at night. I had itching all over and there was no scratching to get rid of it. Now mine was caused by high phosphorus, and we're going to talk about that today, plus many other things that could cause itching. Now, to learn about this, we're going to bring on an expert. It's Tuesday, so you guys know who we have. Renal Dietitian Jen Hernandez. Hey Jen, how you doing?
Hi, James. Hey, everybody. I am doing so well. Happy to be back again this week talking about itching, which is something I know that everybody is itching to get into.
Awesome. Little dad joke there.
Yeah, yeah. Oh, I've got plenty of those. So, for those of you that are new, welcome. My name is Jen. I am a renal dietitian. I am a registered dietitian in the United States that is also board certified in renal nutrition. And I did that by not only being a dietitian, but focusing on people in the kidney community. So when I was a pretty fresh dietitian, I jumped right into working in the realm of dialysis and helping people with kidney failure make the most of their diet so that their dialysis would go smoother and they would feel better and have more energy. Then I was working with the National Kidney Foundation, doing kidney screenings, helping people with earlier stages of kidney disease prevent the need for dialysis, which kind of segued me a little bit more into dialysis again. And then finally, here in my private practice, which is plant-powered kidneys. And I work with people privately. And I also have an online course that is called Plant-Powered Kidneys. And it's a 6-week program where we run through the fundamentals of kidney nutrition to get you off on the right start. So tonight we're going to be talking about this itching for kidney disease, the causes, what you should know about it, how you don't just want to assume what's going on, but what you can do for it.
Awesome. And for those of you out there who have not yet joined the Plant Powered Kidneys Facebook group, hop on to Facebook after you're done watching this show, or if you pause and take a break and join the group. Doesn't cost anything. Jen's there. I'm there. There's tons of great people sharing fantastic recipes, meal ideas, all sorts of great information. Now, for those that are new, you can't, there's no treatment recommendations or anything like that. That comes from your doctor and your healthcare team, but you're going to get lots of ideas and lots of general positivity and helpful information there. So I encourage everyone to join the Plant Powered Kidneys Facebook group. And if you want to learn more about what we're talking about today, itching and kidney disease, Jen has a blog on plantpoweredkidneys.com with what we're talking about today and so much more information that we won't have time to get into. So I encourage everyone to jump over there later and check out the blog. All right, let's get started, Jen.
Yeah.
Itching and kidney disease. Oh, it is so, or at least for me, when my kidneys got really low, that was a problem I had. And oh my goodness, it just drove me nuts. It was an itching all over. Mine was caused by the phosphorus, and I know we're going to get into that. But what is this itching and kidney disease? Why does it happen?
So the technical term for it is uremic pruritus or CKD associated pruritus. And this basically is a fancier term for itching or itching of the skin. And essentially, there's a lot of thoughts as to where it comes from, what it's caused by. There's not just one exact situation or association that we can say, oh, this is what's happening. There's several factors, and we're going to go into those factors and what's going on there and what you want to pay attention to, because this is going to be something that you can kind of use as a checklist of, okay, let's see if this is the problem, this problem, this is the problem, and go through and work with your healthcare team about that. Because this itching is no joke. It affects a lot of people. Like James, like you mentioned, it's going to be really predominant in dialysis, but also late stage. And there have been cases where even people with stage 3 kidney disease, which is a mild or moderate type stage of kidney disease, have also reported this symptom of itching for a kidney disease. So it's something to pay attention to. Now, this, if you notice that it's getting worse, if you notice that's happening more frequently, and this is not like a over your skin dermal type of itch. This is like a deep underneath your skin, can't get to it kind of itch. This is something that is happening on a deeper level, right, James?
And no itching takes care of it. Or no scratching. All the scratching does is just scratch up your skin. And for me, I actually had small white bumps, but they were under the skin, and that was because mine was caused by the phosphorus. But yeah, no scratching got rid of it. No real lotion got rid of it, and we don't want to cover it up. If we have this problem, we want to find the cause so we can take care of it and address it.
Yeah, exactly. And like I mentioned, it's pretty common. I saw it all the time in dialysis. So many of my patients had this, and I feel like probably more than I even realized, because it's one of those things I feel where, somebody just thinks, oh, this is just how it is. This is just what I need to deal with. And, I see them coming in with their, those the back scratchers, the
Oh
long
yeah, I have a
sticks.
metal one.
Yeah. Yeah, I would give those away. We would play bingo. We would have like contests and things like that. And those would be my prizes a lot because they were so prized. Everybody wanted them. So, it was very common to see people walk into dialysis carrying that back scratcher, knowing that they were going to be itchy during dialysis. So it could happen to upwards of like 90% of people. But in older dialysis, it used to happen to everybody. It used to just be like an associated known side effect with dialysis. So it has shown some improvement with the advancements of dialysis, but it's still not really quite there yet to where it's not being affected by anybody.
Yep. So what causes, mine was phosphorus, that's one of the causes, but what are the most common causes of this itching for people who have kidney disease?
So one of the things that can happen is having too much urea, or it's uremia in the body. And this is basically what kidney disease is, where you have this excessive urea that is building up in the body. And this is a toxic product of the body that's supposed to be gotten rid of from the kidneys. And then for dialysis, the dialysis will help remove the urea. However, there can be an excessive buildup, sometimes from not having enough dialysis, that can cause this buildup. And this can affect kind of this cascade of effects in the body because of the toxin that is staying built up in the body. And part of that is activating this itching situation, causing this itch. So first of all, check if you're on dialysis. I know everybody on dialysis out there. I'm so sorry, but talk to your team about if you're getting adequate or enough dialysis. And I know this is like the last thing anybody on dialysis wants to hear, because nobody in the entire world has ever said, oh man, I would love to sit in for some more dialysis. Like, that is not the thing. But if you are committing to doing something so important for your health, you really want to make sure that you are doing it the best possible way you can and really working to prevent these kinds of complications. Because if you are not getting enough dialysis, this is, again, this is just a domino effect that we just see down the road. There's going to be a lot of other issues that come up. So just rip off the Band-Aid, talk with your healthcare team, and make sure you're getting enough dialysis so you can check off that this is not a potential cause for your itching. Now, another thing kind of along the same idea, and this is something I think we'll dive into a lot more, is this imbalance of your phosphorus, which also leads to this imbalance of calcium and your parathyroid hormone, your PTH. So James, you said that
That
was
was
your
mine.
thing, phosphorus.
Yep. And I
Yeah.
learned that phosphorus and calcium have a relationship, and it was pretty much I had too much phosphorus, which can result in pulling calcium from your bones and weakening them some. And then the little deposits were the dots under my
Yep.
skin, which caused the itching, and I could not itch those away. It just took time, got my phosphorus under control. But whew, I remember for about a week, that was very challenging for me.
Yeah, it is definitely one of the hardest things for dialysis. Not impossible. I do feel like we're getting on the diet side, we're getting a little bit better with promoting a newer, better renal diet for dialysis. The older renal diet, I think was a little bit harder for phosphorus balance because some of the things that were promoted, and in some cases still are promoted, like extra animal protein, even dairy in some cases, that has a higher phosphorus content that's absorbed higher. Plus, fast food, we know that's the number one cause for high phosphorus, and sodas as well. But all of this extra phosphorus coming into the body is going to cause this imbalance. And your body's already trying to take care of this imbalance as best as it can. When your kidneys aren't functioning and you're getting so much dialysis per week, that is going to lead to a potential imbalance. So, like James was talking about, phosphorus and calcium are best friends, and where one goes, the other will follow. They're stored in our bones, but if there's too much in our blood, they will pull out from the bones and create this risk, this weaker bones situation, risk of breaking bones. I've the horror stories of people breaking their bones from standing up out of a chair, stubbing their toe on a curb and breaking their foot. It's really, really dangerous, and it just again causes this cascade of problems. So this imbalance of calcium and phosphorus will also be a part of potentially this imbalance with your parathyroid. All of this is affecting your bone health, and those calcium and phosphorus crystals, basically, those are essentially collecting in the blood, going through the bloodstream. So you imagine these little crystals that are just kind of floating through here and settling in your soft tissue. And that's where the itch starts to come from. So like those little white dots that some people see, like James, you mentioned, some people will see them around their eyes or even on their eyes. That could be another sign that you have too much phosphorus. And all of this is going to really increase. That's one of the first things I ask when somebody tells me they're itching. As the dietitian, I'm asking them about their phosphorus. I'm looking at their bone labs to see where we're looking at there to make sure everything's balanced, because that for me is one of the most common things that I find.
Yeah, and I know someone who visited, maybe it was last summer, she visited here, a friend who has kidney failure, and she had the itching and wasn't controlling her phosphorus, even using binders. And it was shortly after her visit, she fell and broke some bones. I can't
Yeah.
remember which ones they were, but it was related to not being able to get her phosphorus under control. Um, it was hard for her to stick to the diet. It's very important for us to remember,
Hmm.
like we talked last week, all the things we are protecting when we protect our kidneys.
Yes.
But yeah, she had that problem with her bones, and it really sank in for me. Like, holy cow! I'm gonna make sure I'm going to keep that under control, especially with phosphorus. That's that sneaky one that's in
Yeah.
so many things, the chemical phosphorus that we absorb or take in so much more of.
Mhm.
Oh, yeah.
Yeah, I'll tell you that like one of the very first horror stories I heard from a dietitian who was training me when I first started in dialysis told me about a patient on dialysis who stood up from their dialysis chair and broke both their legs from standing up. That was it.
Oh, oh.
Yeah. Yeah. So it can get really, really weak. And this is something, you guys, that this is not overnight. This is not something that's just okay today, horrible tomorrow. This is a really long-term problem. So even if your phosphorus is running a little bit high, you might think, I feel okay, I don't feel any problems. Don't let that be the excuse for you to let it slide. Like don't go around it just because you feel okay now, because that is the indicator. Those labs, that's the indicator that something is going on and you've got to jump on it and take care of it. So it just always breaks my heart when we see stuff like that happen, where it's just been going on for so long and they felt fine and everything was okay until it wasn't.
Mm-hmm. Well, that's kind of the MO
Mm-hmm.
of kidney disease. We think we're doing fine, and then things get really bad, and that's when we really notice. That's what makes kidney
Right.
disease such a challenge.
Mm-hmm. Yeah, exactly, exactly. And that's the thing, just like we're talking tonight about itching, that, if you don't notice it too often at first, that's great. If you notice it getting worse and worse, that's the sign that there's something going on. This is being triggered by something, and you really want to dive in and work with your team to find out what is going on. So, kind of diving further into some of the other potential causes. Of course, we have all of the like allergic reactions. So they used to often prescribe antihistamines to help prevent this itch, which they found to be okay, but not really conclusive in taking care of this itch coming from kidney disease. So there's still some potential benefit in that, but it's not necessarily going to solve it. But again, this is part of the checklist of maybe this is associated. What we do know is that there is an association with inflammation and kidney disease and this pathway that triggers this itch response from inflammation. So kidney disease will lead to generally higher inflammation. It's just any kind of chronic illness can trigger higher inflammation coming from your C-reactive proteins, your TH cells, your interleukin cells. These are different types of cells and actions in the body that will lead and trigger this cascade of events to try to focus on taking care of the inflammation. So all of these things associated would be some kind of inflammation, immune reaction, like something going on there with the body. And that's going to be something where you talk with the doctor about for if you should be on antihistamines for it or try them out. And then, of course, we have dry skin, which this is pretty common. It is tough with kidney disease, especially in these later stages. If you're on a fluid restriction and if you can't drink that much water, it's not going to be as easy as, oh, just drink more water. Although if there's dehydration, that can lead to drier skin. And of course, this will lead to itching. So something as simple as lotion may or may not help, but it's at least another step in being preventive and crossing it off the list and saying, okay, well, if I'm going to make sure that I have lotion, that's one less thing that I have to think about or worry about when it comes to this itching, because I'm going to take care of that. And there is there's this term associated to really, really bad itchy skin called nephrogenic systemic fibrosis. And this is basically where the skin gets thick and tight and hardened, almost like scarring. And this is something that can happen with long-term health problems. It can happen with dialysis long-term. So it is something to be mindful of, but medically would be looked at, not necessarily treated depending on what's going on there, but it would be something to talk to the doctor about to see if that is something that you need to be concerned about and paying attention to. So a whole other area that may have to do with itching for kidney disease are other health conditions that are associated with kidney disease. One of the most common causes of kidney disease is diabetes. And it's been shown that higher blood sugars are actually associated with being more itchy. People with more abnormal blood sugars have reported being itchy more often.
Oh, I can, yeah. I have no comment for that. But I didn't know that one. That one's a new one to me.
Yeah, yeah, it is. Diabetes has a lot of like dermal kind of things. So if you think about um, the diabetic wounds, how people who have wound issues, if you have diabetes, you have a harder time healing. There's a lot of things associated with good controlled diabetes and having better skincare than poor controlled diabetes. And then if we think again about this whole idea of itching and scratching so much that people actually tear through their skin. You actually can cause damage to your skin. And if you have poor blood sugar, that is causing this itch. And then you have poor blood sugars that can't help keep the skin healed and protected. It can lead to wounds. It can lead to just a lot of problems. So controlling blood sugars could be something to look into if you are getting itchy. So pay attention to your blood sugars. A couple important or interesting ones I would say are hepatitis and iron deficiency anemia, which we know is one of the first things that you might realize when you have CKD. If you have lower energy levels, you have fatigue and just can't really keep up through the day, even some brain fog, that could be something to make sure that you're managing so that you don't have these issues with itching.
Yeah, when I had my itching, it started before I went to the doctor.
Mhm.
And I had the low energy, the constant fatigue. I had severe anemia. Um, my iron was extremely low. I had the high phosphorus. Oh, I was miserable.
Yeah.
And I delayed telling my doctor, which only made things worse by
Mhm.
delaying getting them taken care of.
Yeah,
So just a
yeah,
quick plug to
exactly.
tell your doctor if you have any of these symptoms. If anything weird changes,
Please.
mention it.
Yeah. Yeah, definitely speak now before you can't. Before it just gets too out of control and the doctors say, "Well, there's nothing we can do at this point," because that's just the worst thing you don't want to hear. Be proactive and jump on this stuff.
Yep.
So another thing that I thought was pretty interesting was this connection with the what they're called opioid receptors that basically help in our central nervous system to reduce pain. But in people with CKD and with people who had this itching, they noticed that these receptors to reduce pain, the activity was lower. So there's already this kind of offset in the neurological processes that are going on that decrease this pain reduction uh, basically system, I would say. So this is something to, again, pay attention to and just talk with your doctor about it because there can be some potential benefits to certain medications, which we'll talk about in a little bit here. But this is something that where they did see that those antihistamines did not help very much in these cases. So that's again where you can try the antihistamines, but don't hold your breath. Don't think that that's right away going to take care of it. You're just going through the checklist to see what you can do to take care of it.
Yep. And we just had a question Pat had asked, does calming lotion help? One thing I would like to say, and then we'll see what you
Yeah.
have to say, Jen, is those lotions, and I tried those, the ones that had like a numbing cream or something in them, they're just covering up the problem. They're not addressing the real underlying problem. And I delayed telling my doctor about the itching and other symptoms because I just, for some reason, I just felt like it'll go away. This doesn't have anything to
Mm-hmm.
do with why I feel sick. And I was only hurting myself by
Mm-hmm.
delaying in telling those things. So I don't encourage people, and I'm not a doctor, but I don't encourage you to do the lotions to try to cover it up, the kinds with like lidocaine and stuff like that in it,
Mm-hmm.
because you're not addressing the root cause, and it's a sign. Things may
Right.
be out of whack, and you need to change something. Is there anything you want to add to that, Jen?
Um, I would say from what my patients have told me that the itch is deeper than right on your skin.
Mhm.
So you put anything dermal on, it's going to be an exterior type of solution. And from what they would say is like those itching creams just don't like penetrate enough. They don't
Yeah,
get into the
I
skin
actually
enough.
used burn cream. So I have like the world's greatest, um, uh, what are they called? First aid kits. Um,
Okay.
my dad's a firefighter, and we've always been related, or something's always been with healthcare in our life. So I have the best first aid kits, and they have the burn cream, like severe burns. You put it on, it kills the pain. Uh,
Yeah.
and that's what I was using to stop the itching on my legs, which it made the itch go away for a little bit, but it wasn't helping me. It was actually just allowing my problem to get worse.
Yeah, so maybe if anything, if you're looking at using an itch cream for like the immediate, like this is just driving me crazy right now, then that could be something that would be helpful. But make sure you put a note somewhere or you send a message. You know, a lot of doctors have chat and text features in their portals right now. So, you know, send a message to your doctor and say, "Hey, I'm itching like crazy. I can't go to sleep. Like, what can I do? What can we do about this?" And you really want to make sure that you pass it off and bring, well, I don't want to say pass it off. You want to bring your team into the situation so that you and they can start working on a real solution.
Mhm.
The lotion is a band-aid. It's going to help cover up what's going on, but it's not going to heal what's going on.
Yeah. Now let's say, so we've talked about a few, or a lot of things that could cause this itching.
Hmm.
Now, and we mentioned a couple of the issues with the itching, like my skin, especially my legs, the bottom of my
Hmm.
legs. Oh my goodness, it looked like I was running through some blackberry bushes or something in shorts. They were all scratched up. What are some of the ways that this itching will affect my skin as a person with kidney disease?
Well, our skin is so important. It's the very first protector for our body. It's keeping the stuff that we don't want out and it's keeping the stuff that we want in. So we want to make sure that we are really careful with our skin. And when we're itching, and if you're itching a lot, then that is going to increase your risk of kind of skin breaks or tears or wounds. And that is going to lead to potential problems with infections or wounds that can't heal. But even on the not as intensive side, we are looking at things like we talked about that thick, tighter skin. You might end up developing calluses, scars. You could have color changes to your skin, and I saw that quite often. You can tell people have been scratching chronically because you would see their skin colors change. They'd have different shades of their skin, you know, anywhere, their face, because they were scratching so much. You can even have changes in your nails from how much you're scratching. You can have those calcium deposits, like we mentioned, those white bumps. You might see those come up through your skin. It's not something that really can be surgically removed. The calcium deposits are, you might see some of them on your skin, but there's a lot on the inside as well. And if they're coming up through your skin, that's that physical, like literally you can see the indicator that you have too much calcium and phosphorus in your body, but there's not a surgery to get rid of it because all of these little deposits are settling into your arteries, settling into your vessels, and hardening all of this soft tissue, and essentially turning you into stone. Like it sounds really scary because it is really scary and it's a long-term problem. Again, this stuff doesn't happen overnight, but after dealing with this for a long time, because this itching can last for months and years if it's not well managed. So again, this is not something from today, tomorrow will just happen overnight, but it's something to pay attention to as you're before you're on dialysis, as you're starting on dialysis, and as you're going through dialysis. Oh, I think you're muted. Are you muted?
I am muted.
Okay.
It's allergy season here. So I have a little bit of a cough, and my mom has a sneeze that you can hear for blocks. I inherited that. So I keep muting so that I don't scare people with the sneeze or something like that from the allergies. What are some of the available treatments that we could turn to if we've got these itches?
So one of the things that we mentioned was just talking with your team about dialysis. Make sure that you are getting the right amount of dialysis that is cleaning out as much as possible. Dialysis is trying to take over what your kidneys were doing 24 hours a day, 7 days a week, no matter what. And dialysis, we know, is not 24 hours a day, is not 7 days a week. Thank goodness. But there's a sacrifice with that shorter amount of time that's replacing all of the work your kidneys used to be doing 24 hours a day. So make sure you talk with your doctor. Don't cut your treatment short. Please, please do not cut your treatment short. You have a prescription for dialysis that is calculated based on your body and your needs. So stay for your full dialysis time. Talk with your team and make sure you're getting the right dialysis. It doesn't always mean an extension of time. It could be a change in your dialyzer. It could be a change in the dialysate setting. It could be a variety of things, not necessarily just time. So make sure you talk with your team about your dialysis. Now, this is going to be a topic that is kind of big, but inflammation, we're looking for any kinds of things that are causing inflammation in the body, and that can be really, really, really so many things. Chronic kidney disease in of itself can cause inflammation, so that's going to be something we can't really control, but we can look at other factors that might lean towards problems with inflammation. So if you're having any gut issues where you're not digesting things well, if you're having constipation or diarrhea, nausea, vomiting, anything like that, that's telling your body something's not going on right, that will be a sign of potential inflammation. We've talked about albumin before. Albumin is a protein in the blood. It's not the protein from your diet. But if you have inflammation, albumin helps with taking care of it. So if your albumin level is low, that is an indicator that you might have some inflammation going on in the body. So again, looking into your other health conditions. If you have diabetes, looking at your sugars. If you have thyroid issues, making sure your thyroid levels are taken care of. If you have osteoporosis, if you have gout, hypertension. I mean, we've talked about so many of these things that you just kind of want to filter through and pay attention to what is going on for you and see what you can do to better manage that. Again, talk with the team about what is causing inflammation and what you can do to help lower that, because this inflammation can cause this itching to occur just simply by the reaction that our body is taking us through, trying to protect us. So we did mention the creams, and some lotions may be helpful. It really, really depends on the person. We don't recommend it as the solution, but in an immediate fix that you're really trying to go to bed or just trying to get through your day without scratching your arm off, then that might be helpful. There is a type of specific types of lotions, the kind that have menthol, para, pramoxine and capsaicin. Capsaicin is actually it's an ingredient found in peppers. So these kind of things topically, so meaning on the skin, might be helpful for some people. Again, it really, really depends on each person and how they are affected by it. But, oh, you're muted again.
Thank you. It's a big giant red button, but it's way over there. I gotta move it later. The capsaicin, that's in a lot of the ones that are heat, like those creams that kind of give you some heat for muscle relaxing. They have a lot of those, yeah.
Yes, exactly. So some of these can be helpful, but you can try it out, see how it works, maybe talk with your doctor about any kind that they recommend to their clients, or I mean, if you're on dialysis, even asking your neighbor at dialysis if there's anything that's worked for them. That might be something to try out. There's a Potential that essential oils can help with, so the calming essential oils, but this is topically, not ingesting them. I never recommend ingesting essential oils, despite what some places do recommend. But topically, these might be able to help with soothing the skin. So whatever it is, make sure you try something that is um, try something in a little bit first to make sure that you don't have any kind of reaction, especially like, James, like you mentioned, the heating, the warming type of lotion. If that might cause a reaction, then doesn't really help. It just doesn't make it feel any better. It makes it
Mhm.
feel different or worse.
Yeah. The only, yeah, I found the only thing that worked was the burn cream. It's just because it's got so much lidocaine in it. It just
Yeah.
numbs you. But
Yeah.
it's
Yeah.
expensive, so it's not that I would encourage everyone to run out and grab. It's good to have in your first aid kit in case you ever have any burns.
Hmm.
But it's expensive to buy.
Right. And that's just kind of another thing of, you want to make sure you figure out what's going on so you're not paying all this
Hmm.
money for something that's just covering it up.
Yep.
Okay, so the medications. There are some medications that may help. There's been studies that show that gabapentin can be helpful in lowering the itch, and this is actually a medication that is more commonly prescribed on dialysis. I would see it all the time for people on dialysis. So you can talk with your doctor about gabapentin if you are having an itch. It usually is around 100 to 300 milligrams. So, you'll want to talk with the doctor about what you're able to get for that. There's also let's see, pregabalin, and that one showed that taking that at night could be helpful with lowering the itch. So if you can't, if the gabapentin's not working, then you can try I always have a hard time with this one. I don't know why. The
I don't pronounce any
pregabalin.
medications, even my own. I just butcher
I
them
I
all.
swear I practice this, and well, I mean, not too much, but but anyway, that's another medication that you can try. Again, talk with your doctor about it. The gabapentin is the most popular, most common one, so that's usually going to be the first one. But if you're having an adverse reaction, if it doesn't seem to work for you, then this could be another option. And then the antihistamines, we did mention that there's not really anything that is showing that they're very helpful, but they are still prescribed sometimes. You can still get it and just try it and see if it helps. And I mean, it's an option. So it's a little bit of a more outdated option. But, if it's recommended to your doctor, there's no harm in trying it if your doctor is prescribing it. So there's this other pretty interesting newer idea for preventing the itch, and it's non-invasive. It's not medication. It's not even diet related. So there's actually a couple of them. One of them is, it's called phototherapy. So this UVB, this ultraviolet B phototherapy, works in stopping the spread of the response that triggers this itching. So there have been studies that show that this phototherapy can be helpful in reducing it. It's something that you want to talk with your doctor about, find out where you can get it done, like the whole process. To be honest, I've never had a client go through this. So I can't speak to the experience of it. I can't even speak from like oh, I know somebody who did it. If anybody's watching that has done phototherapy for itching, I would love to read that in the comments and to just kind of hear more perspective of it. But this phototherapy has been shown to be helpful in lowering that itch. Another thing that's pretty interesting is acupuncture. And some people believe in it, some people don't, but it may be helpful to block the itching impulse. So, if you know an acupuncturist, if it's something that you would be interested in trying, this might be something, again, that's non-invasive, not a common medication, or I'm not saying do this instead of lowering phosphorus in your diet, because I'm a dietitian and I'm always going to tell you to watch out for phosphorus. But I will say that this could be another great option that could be helpful in stopping that pathway when it comes to this cascade effect of this itching response.
And I've never making sure I'm unmuted. I've never tried acupuncture for anything. It just, every time I've seen it, it's always been in a comedy movie.
Uh-huh.
And it never goes well. So I'm actually afraid to even try it.
I really wanted to, and I actually I knew someone in Hawaii who was a acupuncturist,
Hmm.
but when we met, it was like basically right before COVID, and then we couldn't, do anything like that, and then I
Mm.
moved, and so, but I think it's very interesting, and I'm really curious to try it out. So I'm curious if anybody in the audience has tried either the phototherapy or the acupuncture, because I mean, I'm not going to shake off. You guys know I'm very cautious with like herbal remedies and things like that that are you're putting into your body. But if it's something like this that is not invasive per se, because I think food can be invasive in a sense that you're ingesting it. Um, I think this is kind of interesting, and I'm glad that they are looking into these different types of therapies.
Yeah, and I've never heard of the phototherapy. I have heard and tried the cold
Hmm.
therapy, where you kind of go in there and it's very, very
Oh yeah,
cold.
the cryogenic, right?
Yeah,
Uh-huh.
you know, you're very, very cold.
Uh-huh.
It's tolerable. I only did it once. I was like, okay, I can't do this on a regular basis, and it was kind of pricey.
Yeah, I've heard my sister-in-law tried it. I think she did it for a little while. She got some Groupon or something for it. So she was
Hmm.
like, yeah, sure, why not? But yeah, she said the same thing. Like, I don't know if I would continue to do that for like a longer period of time. But hey, maybe we find out that cryogenic therapy is helpful for itching because it slows down the process of whatever,
Yeah,
We
who
don't know. We
knows?
don't know. We've got to do more research. So there are some other medications that we do see potentially being helpful in stopping the itching with kidney disease. So there are these opioid, so I mentioned the opioid receptors that lower this pain issue, or lower the pain receptors basically. So this medication called nalfurafine, this is an opioid receptor antagonist that works as a pain reliever, and it basically inhibits these uh, itching triggers in human studies. And they found that or I'm sorry, in animal studies, but in human studies, they found that it was fine with rarely side effects, but they did see that it was really helpful to itching. So they're kind of looking at it as, well, we know the way it works. We just need to see what needs to be done to see how it can really help with the itching part coming from this opioid receptor activity. Now, there is another medication called nalbuphine, and this one also works with that preventing or blocking the opioid receptor, and it has been shown to help people on hemodialysis with their itching reduction. There's another medication called, oh my gosh, okay, this one I am reading off my list, you guys. Um,
I just saw your list. I'm not going to pronounce any of
Shoot.
these.
What did I get
Except this
myself
one. Yeah,
into?
the abbreviation CR845. There you go.
Let's run with that. And then you have to go to the blog if you want to see the real
Yes, and the link to the blog is in the description. And I actually just a
word.
few moments ago posted it in the comments because someone was asking for the spelling of some of the words. And they're
Yeah,
all
yeah. So
there in
we
the
have,
blog, them and so many
yeah,
more.
yeah. So I'm usually pretty good about words, but some of these I'm like, no, I don't know if I can do that right now. It's the end of the day, guys. I don't know.
Yeah.
But so we do see some of these other medications that are all kind of working the same way. And then there are the idea of the cannabinoids. So this is something that may be helpful, but we need to really look at it from a bigger picture. We can't, anytime things are studied like this, we can't just look solely at what we're trying to see what we want it to do. We have to look at all of it. We have to look at the side effects, anything else that might come up, any other reactions or problems that could come up when they're testing something. So that is something where I'm even pretty hesitant on, because, and people have asked me about them, I'm like, they're not well enough researched. So It's not something that I'm going to recommend. So just, kind of keep that in mind that your physician may have some other opinions about that as well.
So we mentioned a number of medications.
Hmm.
Some have complicated names. They're all listed in the blog for everyone else. How about my favorite way of trying to manage problems, which doesn't always work, or manage symptoms, but what
Hmm.
about diet? What can I eat or maybe not eat, or, look at adding into my diet nutritionally that might help?
Yeah. Well, okay. So the first things we'll just kind of run through really quick are the foods we talked about limiting or avoiding. So fast food and sodas, phosphate additives, anything that has PHOS in the label, that is a phosphate additive and it's absorbed 100% into your body. So when you're looking at the ingredient list, even if it's the very last ingredient, it's still potent. It's still 100% absorbed into your body. And that will be something to be really, really careful about if you are already trying to take care of your phosphorus levels. If you already have issues, that can be something that will just be so, so helpful in managing your itching by reducing your phosphorus intake. So, with that, controlling your fast food, controlling your sodas, your additives, all of that is going to be really, really helpful. When we talk about adding foods, you guys know, plant-powered kidneys, I'm going to
Mm-hmm.
say adding in fruits and vegetables, adding in things that give us a lot of bang for the buck. And by that, I mean all of the nutrients that come from fruits and vegetables. These nutrients help fight inflammation. These are things that our body needs, our body craves. We've talked about the vitamins, we've talked about minerals, electrolytes, all of these things that our body needs. And fruits and vegetables do a really wonderful job giving us those. Now, you want to eat a variety and you don't want to just focus on the same ones all the time. It's really important that we do have some variety in our diet so that we're getting different types of nutrients from these different colors and types of foods. So it's very important to do that. Now, again, back on the other hand of things to be careful of, animal proteins. And this is, again, like when we first started talking about this at the top of the hour, the old renal diet, especially on dialysis, was protein, 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 meat, meat, meat all the time. Even when I was working in dialysis, this was something that was still really heavily encouraged because the old school thought was you need to have a ton of animal protein to basically help cover your body. Well, you do need protein, yes. In dialysis, your body is getting depleted of protein. It's taking out a lot of protein. So, somebody on dialysis will have higher protein needs. Now, we've talked about CKD usually is lower protein. So, people not on dialysis with mid, late stage CKD probably going to be focusing on a little bit less protein. But once you're on dialysis, you've got to have more protein. It doesn't have to be animals, though. The phosphorus from animal meats is more absorbed than the phosphorus from plant proteins. So, having foods like soy, tofu, tempeh, edamame, those are going to give you the protein that your body needs, but it's not going to give you the phosphorus that your body doesn't need. So, making a switch doesn't have to be all the time, but for a couple meals, try to, instead of having an animal protein, try to have a plant protein instead. And that can be really, really helpful. So, paying attention, fruits and vegetables, plant proteins, you still want to do whole grains. So, if we're talking about dialysis, controlling blood sugars, whole grains are very important to do that because of the fiber content. And that's really, really one of the biggest things I feel for managing your sugars and getting a lot of nutrients too.
Awesome.
Okay.
And one thing I've been chatting in the comments. We've got some
Ah.
great conversation going on. A few people who are newer here, some of these things they may think beans, nuts, they're higher in potassium or phosphorus, and I just want to kind of emphasize it's all about portion control.
Mhm.
It's not getting too much of things. You can still work those into your diet. I use a food tracking app. I set in
Mhm.
my minimums, or I set in my maximums. I know what my minimums are, and I just eat. If I'm going to add, if I want to eat a food, I put it in the app and go, oh, that's too much potassium for the day. I'm not going to eat that. Or maybe I'm only going to eat half of it, have a smaller portion size. So I don't want anyone to be scared thinking, oh, but these things you're talking about, they have potassium, they have phosphorus in them.
Yeah.
A renal diet is not about avoiding, it's about managing your portions and getting, enough, but not too much.
I mean, so one example that I think kind of throws that idea a little bit out the window. So a half a cup of cooked ground beef has 120 milligrams of phosphorus, which is absorbed 60%, I believe is what it is. Lentils, it's absorbed about 40% and it has 160 milligrams. So it's absorbed less. They're pretty close for a half a cup. So equal portions. The lentils it looks like it's more, but it's not absorbed as much. But you're also getting fiber from those lentils. You don't get any fiber from any animal product. And you're still getting your protein. You're still getting potassium. You're still getting, less sodium. So you're getting these nutrients that your body needs, but that phosphorus is just not absorbed as much.
Yeah, and that's a huge thing, which I didn't know in the beginning until we talked about it. It seems like a long time ago, but it was probably just a couple months ago. We had that chart, which is in one of the blog posts on plantpoweredkidneys.com, which talked about these foods, these natural forms of phosphorus are absorbed so much less than this type or those artificial ones that are added in. Now we're getting close to the top of the hour, so I'm going to I want to hit there's 2 points I definitely want to have you talk about.
Okay.
Anemia, because that's a big one that a lot of us, especially when our kidney disease gets low and we're more likely to have this itching, we're more likely to have anemia too, due to a iron deficiency. What can we do to address that?
So there's a few things that I've recommended before, and these are simple things that you can do without medications or supplements or anything else. One thing is to cook more with your cast iron pan, your cast iron skillets. The iron from those will actually get into the food. So this is not like an overnight thing, but if you make that a habit, if you make that a routine and use your cast iron, that can be awesome. Another thing you can try is Lucky Iron Fish, which I believe now they're doing Lucky Iron Leaf, which I love. But it's actually this
That is
iron.
cool.
Yeah. So it was a fish, like a bar of soap, and you would drop it into whatever you're cooking, anything that has some liquid, like some stews or soups or something like that has liquid, or a broth it can sit in, and it will infuse the food with the iron that's from there. And then you take it out, you rinse it, you will use it again next time. So you can do those two things just in the cooking techniques, and that can be really helpful in, again, not overnight, but long term. You want to talk with your doctor about any type of oral iron or IV. Many people do get IV iron injections, and it's called the EPO, which we did talk about, protecting your body to make sure your kidneys, to make sure that it can make red blood cells. So you want to work with your team, and your doctor will be keeping an eye on that for you, and usually will let you know when it's time to get something like that done. In the meantime, you can ask about oral iron supplements. Some people should have them, some people shouldn't have them. So it's not something to just jump in right away and start taking an iron supplement. You want to make sure that you get it cleared by your doctor that you should be taking an iron supplement. Okay. And some iron supplements are better absorbed than others, better tolerated than others. Unfortunately, one of the most common ones that's prescribed is ferrous sulfate, and that's one that's usually the least tolerated. So if you hear ferrous sulfate, you may say, hey doc, can I get a different type of iron supplement? And I often recommend a different kind to clients because I don't want them to have constipation which is the common. That's what I was going to
say. The side effect of that one is not a good one.
Exactly. So talk with your doctor to see if you should have an iron supplement. Make sure that you're including vitamin C rich foods with your foods that have iron in them. So this is bell peppers, broccoli, strawberries. Think of like the oranges and reds and yellows, and yes, even greens. They have vitamin C. and the vitamin C helps with the absorption of iron. What will prevent absorption of iron is coffee and tea. So you want to be careful about your beverages with your meal, because if you're drinking something that has tannins, then that can block the absorption of iron. So all that work you went through cooking and getting your vitamin C in with your food and doing all of that could be totally hindered if you are drinking it with a certain beverage. So make sure you pay attention to that. Then let's see, I'm trying to think, running through here, if there's anything else about it. I think that's pretty good for the anemia part. What was the second
Yep.
one you said, James?
The second one is something that's always good all the time. Staying hydrated.
Yes, yes. It is very important to stay hydrated, and you really do want to clarify with your doctor, your dietitian, about what your fluid needs are. Because if you're on a fluid restriction, you do want to hit that balance of having enough fluid. It's not going to help to go over. If you're on a fluid restriction, you're on a fluid restriction for a very specific reason. And that reason is your kidneys, your body can't get rid of that extra fluid. If you're on dialysis, your dialysis machine will pull fluid from you to help with that, but there's only so much it can do. And you might think, oh, just crank up the UF. And this is like a dialysis. Just crank up the UF. It's fine. I can handle it. No, your heart cannot handle it. You might think you can handle it, but your heart, your poor, poor heart cannot handle it. And that heart failure is something, it's the most common cause of kidney disease, because our hearts are pumping blood and going through this process all the time. So don't think you can drink more and they'll just take it out of you, because you are really playing a dangerous game with that, and that is not safe. So if you're on a fluid restriction, make sure you stay at the right balance. You want to stay hydrated, but not overhydrated, because that is not going to be a solution.
Very good. And this brings us to the top of the hour. So
yeah, I was just starting to run through.
There's so much more in the blog post. I want to encourage everyone to go to plantpoweredkidneys.com, click on blog at the top. If you're watching this, what is today? The 6th of April, 2021. If you're watching it this week, it's going to be the top blog listed there. Next week.
You know what? I just did an update on my blog, so I started to put it in some different categories. So because I just have so many articles that I was getting to the point where, okay, I've got to separate a little bit. I've got to separate them a little bit more.
I see it. How you organized it. Yes.
Yeah. So they're in categories now, you guys. I have a section for kidney disease, which will be the majority of them. But then for those that are on dialysis, there's some specific ones there. We have lifestyle, which was kind of my catch-all for, like, we talk about vitamins. We talk about when you should see a dietitian. We talk about what you should do when you go to see your kidney specialist. Gratitude meditation, like all of those you can see under there too. So, and then I have a section for kidney stones as well.
Yep. Awesome. Because someone asked about kidney stones earlier in the comments. So tomorrow night, I'll be back with Dr. Butt. We're going to be talking about kidney biopsy. What the heck is it? Why do they do it? What do they discover when they do it? And next week, when Jen is back, we're going to talk about 5 reasons why you should follow a plant-based diet when you have kidney disease. And let me tell you guys, I was the big meat eater. Those of you that have followed me, you know I was the guy that went and got the gigantic steaks. Those ones you see in the TV shows where the people get it and it's just boom. That used to be me. Now I eat very little animal protein because of how it impacts my body. I've added a lot more plant sources to my meals. I'm not 100% plant-based, but I am really, really close. And that has played a huge part in helping me to improve my overall health, which has allowed me to improve my labs and kind of squish all the symptoms that I was suffering from. Want to thank you, Jen, for being here. Fantastic. Always great to have you here. And I want to thank everyone out there that's with us today. If you haven't done so yet, hop on over to YouTube and subscribe to Dadvice TV or the Dadvice TV YouTube channel. Hit the little bell icon. That way, every time we have a new show scheduled, you'll get a notification, and you can make sure to catch the information live and maybe even get a question in the live chat. All right, everybody, it is late. I got to go get me some dinner. I see my kids outside the window already. They're like, Dad, 7 o'clock.
Hey, you can see them. We got sun, so that's awesome.
I know, that's great. I love that it's so bright so late now. Though I'll tell you, I need some sun. I'm not getting enough of it. I'm getting pretty pale. My coworkers noticed that today on a group call. They're like,
yeah,
James, you're not getting outside very often. I was like, I'll change that. I'm going to start walking more during the day instead of late evening.
I love my lunchtime walk breaks. I thrive on them.
That's a great way to fit in a little extra exercise. And I do want to squeeze one little more comment in. It looks like we have a lot of new people here that were asking, hey, is this good for my kidneys? Is this food? There's no food that this is good for your kidneys. You guys are going to read, oh, eat blueberries. It'll do this for your kidneys. BS, okay? Your body breaks it down to nutrients. And those are what then go around your body. That's what matters. Your body needs certain nutrients and not too much. So that's what you need to look at. And that's why working with a dietitian, especially a renal dietitian like Jen, can help you find foods that you like, fit them into your diet so you continue to love eating, which I love eating. Ate a little too much over the last year with COVID. I ate the right foods, but too much. So I'm working on that now. But for those of you that are new, eating celery isn't going to cure your kidneys or do something special for them. But you want some celery, you want to make a snack, put a little bit of peanut butter or something on it. It's not loaded with sodium. Hey, you can do those things, and working with a dietitian will be a great step to help you work the things that you want to eat into your diet.
That's my favorite thing. That's my favorite thing to do. Is like, tell me what you want to eat, and we're gonna find a way for it. Well,
exactly.
Except for the ribeye, okay, James?
Oh yeah. Hey, let me tell you, I have not had a ribeye in so long. I did have some chicken breast over the weekend with some lemon on it. Did I have any other meat? No, that was it. It's like a chicken breast here or there. I'm getting good at my portions of that. Today at lunch, I had some kind of like spaghetti, but it was zucchini.
Oh, I love zucchini
lentils.
Noodles. Yeah.
With some, made up my own little sauce. It was good. And a little bit of asparagus that I steamed. That was a great lunch. 3 years ago, I would have thought, no way. It would have been a Big Mac, supersized fries, and a giant Dr. Pepper, and my health gone down the tubes.
Oh, well, it's all different now, right?
Exactly. And, I'm extending our chat. The best thing about learning to eat healthy and how to make better choices, I'm not just protecting my kidneys, I'm actually adding years to my life by living
good years,
healthier.
Exactly. Years. Not just like I will physically be on earth longer. It is I'm going to be here and be here for my kids and be here for my grandkids. That's the point.
Exactly. All right, everybody. Thank you so much. I'll be back tonight. Jen and I'll be back here next Tuesday. And we'll see you guys in the next video. Bye, everyone.